I am a charge nurse at the St. Francis Downtown Emergency Department in Greenville, South Carolina, which recently has been identified as a hotspot in the United States. When I first heard Greenville and hotspot in the first sentence, I got chills. Hotspot to me is New York City, freezer trucks with bodies in it, and I, quickly went into denial. It's not possible. Greenville can't be a hotspot. We can't handle that. And then I looked at my board at work, the track board at work, and saw how many patients that were there with COVID complaints and realized, no, COVID is here. And it is getting worse.
Today started out with 62 patients in our facility, which equals the highest we have seen, up from about 31 a little over 2 weeks ago. So certainly a concerning uptick that we've seen lately. But now as we begin to open up the city, we've seen more viral spread, more cases, and then a couple, 3 weeks later, predictably, more cases in the hospital.
I remember taking care of one patient in particular, not but 3 years older than I am, no medical problems, healthy, and watching this patient struggle to breathe, gasping for air because of COVID.
We've had families that one person has had it and then everyone comes down with it. While I've seen where we've had families where one person has had it and nobody else has caught it, and it all depends on your technique. It all depends on isolating yourself, wearing your mask, hand washing, sticking to the rules that can help you get it prevented. So it's very important that you stick to the rules, wear your mask, social distancing, it is real.
It's also been very frustrating because we're seeing a lot of patients who are sick who don't need to be sick. This is the kind of illness that if you take some simple measures, you do a few easy things like wear a mask, have some social distancing, wash your hands, you can help stop the spread of this. And the fact that a lot of people aren't doing relatively minor things to help protect their neighbors, to help protect their family and friends who have cancer, who've had bone marrow transplants, who've got sickle cell, who have cystic fibrosis, diabetes even. The fact they're not doing that, it's a bit frustrating that we're not all trying a little bit harder to be good neighbors.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.